Thank you, Nisa. Good evening, and welcome to those joining us in person today. It's a full hall here, so it's so exciting to see a full group here. And for those who are joining us online. And this is Public Health Lecture. This lecture is just one of our, this is Public Health Week events. This is a really special week for us. We started this week with a panel on sugar tax. The session was called The Costly Issue of Sugar Tax, Who Wins? Followed by on Tuesday and Wednesday, we had oral presentation. And I saw many of you browsing through the poster panels today as you walk by to this hall. Exciting posters and exciting work happening at the School of Public Health. Tomorrow is a culmination and a celebration of it all, and we are calling it Community Celebration of Excellence. Many of our faculty have won awards, and so it's sort of a recognition day for us. This is Public Health Lectures, our annual event. We create that to celebrate public health and innovations in research, research and practice of our school community. This is Public Lectures are for us to learn, to think critically about a public health issue facing people and populations globally and locally. Tonight, we'll learn about current climate crisis is indeed a public health issue. It has implications for the health and well-being for all of us here locally and globally. Associate Professor Sherilee Harper will speak on this complex issue. Dr. Harper is a faculty member in the School of Public Health. She joined us last year from the University of Guelph, and we are delighted to have her. And recently, she represented Canada as a member of the Intergovernmental Panel on Climate Change, quite a prestigious panel. She's also a lead author on the panel's special report on the ocean and cryosphere in a changing climate, bringing a critical health perspective to the crisis. She also presented the report to the United Nations member states in Monaco in September, where it was accepted and approved. Dr. Harper holds a Canada Research Chair in Climate Change and Health, and she works collaboratively with many partners, particularly Indigenous peoples and organizations in Arctic Canada, in Uganda and Peru. Her work combines science and Indigenous knowledge, collaborates with partners and prioritizes health actions and strengthen health systems in light of climate change. This evening, Dr. Harper will explain to us how climate change affects us all. She will also remind us of our resilience and adaptability while challenging us to prepare for our future. Please join me in welcoming Dr. Harper.
Okay, good evening, everyone. Thank you so much for coming. I'm really excited to be here today to talk to you about a topic that's really near and dear to my heart, and I think it's also a topic that's really important to a lot of people in this room too, and that's climate change. And today we're going to be focusing on how climate change impacts our health. So climate change is all over the media these days. I pulled up some footage just from the past 24 hours. In the past 24 hours, we see that New Zealand has passed a zero carbon law to help with climate change. Recently, a group of 11,000 scientists warned us of untold suffering due to climate change. There was another piece in the New York Times that looked at the price of ignoring climate change. Wherever we look, climate change is in the headlines, and this is just the past 24 hours. But the question of today's lecture is, how does that impact our health? And this is the question that we're going to grapple with for the next hour or so. So to do that, I would like to start by giving you a little taste of the type of research that I do. And the type of research that I do takes place in collaboration, or takes place in the Arctic in collaboration with Inuit. And so I'd like to use that to sort of illustrate how climate change impacts our health, and then we'll move into how climate change impacts the health of all of us. So to understand that, though, I think that it's really helpful to give you a sense of place. I think the context is really important. So I'd like you to take a moment to just imagine. You might, close your eyes, or you could look at the beautiful photos that will be up on the screen, but just take a moment to pause and to imagine that you don't live in Edmonton or wherever you're joining us from across the country, but that you live somewhere in the Canadian North. So maybe you live in Inuvialuit or Nunavik or Nunatsiavut, which is the northern tip of Labrador. Imagine how the landscape is different. So there's these small rocky bodies of land separated by really large waterways. And imagine how remote it is. So there's no roads going into or out of these communities. There's not even ice roads. So if you need supplies into the community or you need groceries, all of that comes in by airplane. If you need to visit other people in another community or need to go south for something like medical care, you have to fly there. Imagine that in the wintertime, those large bodies of water, they freeze over and they become a highway. So people travel over that ice and snow to access hunting grounds, fishing grounds, places where they can collect berries or eggs. These large bodies of water are their highways. And some people still use dog sled teams. And dog sled teams are not only a great mode of transportation, but it's also a really important part of cultural continuity. In the summertime, those large waterways, they thaw. And then the water still acts as a highway because people can access different hunting grounds or different places to go fishing or different cabins in the warmer weather. Imagine the close relationship that people must have with the environment to survive. The Arctic is a really cold place. Often when I'm up there, it can be -50, -55. So imagine that these people have been living in harmony with the environment in these really cold climatic conditions for centuries. It's pretty amazing when you think about it. Imagine the type of foods that you'd be eating. If groceries have to be flown into the community, you could imagine that groceries are actually quite expensive at the store. You could also imagine the type of food that might be available at that store. Things with really long shelf life, for instance. So a lot of people, most people in the communities, still rely on subsistence hunting and gathering. That's a really important part of their diet. Imagine how the water would be different. Everyone has access to tap water, but it's not always the best quality. So many people prefer to go out on the land and collect water in containers like you see in this photo here. And then they take those containers home and they store those on their countertops and drink that water. And imagine how fast things are changing. And things are changing for a number of different reasons. They're changing for social reasons, for cultural reasons, for economic reasons, but also because of climate change. So those hunting and fishing grounds that people go to and access, those are becoming harder to access because the conditions aren't as safe as they used to be. Animals are further away and harder to get to. The quantity and quality of drinking water is changing. And what we know, based on Indigenous knowledge and Western science, is that those impacts are going to continue to increase in the future. So for instance, we know that right now the Arctic is warming at 3 times the global rate. Canada is warming at twice the global rate, and the Arctic is warming even faster. And we also know that over the next century, that the one place on this planet that's going to experience the most rapid and extreme warming is the Arctic. And that has really important impacts for the environment, for the ice that people travel over, for the weather conditions that people travel in, and also for the wildlife that people have access to. So what I'd like to do now is share some of our research with you. We do both qualitative research and quantitative research. So we look at how climate change impacts our health using numbers and models and statistics. But we also talk to people about their lived experience so we can understand what it's like to be living in a changing climate. So what I'd like to do now is share some Inuit voices with you through the participation of our audience. So with the person with participant card number 1, could you read out this quote?
People described the warming climate as wrong, worse, very unusual, treacherous, unheard of, horrible, wicked, different, sudden, big, really obvious, really bad, really startling, depressing, quite profound, severe, uncomfortable, very strange.
So you can see that by these words that people are using to describe what this warming climate means for them, they're all negative. People don't have anything good to say about these climate change impacts, and that's because it impacts their livelihoods, it impacts their lifestyle, and importantly, it impacts their health. So for instance, wildfires is something that northern communities are having to increasingly grapple with. And there was one study that was done by Warren Dodd and his colleagues in Yellowknife, and this was right after a major forest fire that they had there. People talked about how it impacted their emotional health. Participant number 2, could you read out your quote, please?
Well, it took a toll on me because being stressed out from the fires and never knowing when we had to leave to be evacuated, we didn't know if we were going to come home to a community or to our houses. We didn't know nothing. We didn't know what to expect, not knowing what lies around the corner there. So it was really stressful. People still talk about the fire and how it affected them emotionally. We're still dealing with it. We still struggle with it. We don't know if we're going to be hit with another fire again, so it kind of stalls you from doing a lot of things, and you can't really go anywhere too far out of the community because you don't know if the fire is going to come back or not.
And climate change also has impacts on wildfires in ways that impacts our physical health as well. Another participant from this study shared how it impacted them physically. Number 3.
I couldn't breathe and I couldn't work. I've got a niece of mine who is asthmatic, you know. She was having real troubles. She had to actually physically leave town. The puffer just couldn't keep up.
And people also worry that these impacts, what it meant for their future. What would future wildfires mean, especially if all the climate change projections are indicating that those are going to increase in the future? So another participant shared their worry around this.
I don't want us to ever have to go through something like that, but I think more and more we realize, and a lot of people realize, that unfortunately something like that might become the new norm.
And it's not just wildfires, it's also food. And so this probably isn't that hard to imagine what it must be like to have climate change impacting the wildlife in your area and how that might impact the food that you're able to take home and put on the table. And so in one study that we did in collaboration with Inuit, one Inuit woman explained to us the impacts that it not only had on their access to country food or locally harvested food, but also the impacts that it had on grocery store food. Number 5.
The food sources that you usually get to, you can't reach. There is not enough snow. There's not enough ice. It's alarming that we are just seeing the beginning of climate change. And if the weather is down bad for 5 weeks, how do you get food in there? I mean, their stock was down to bare bones because there was no way to get food in.
So it impacts the ability of stores to get food in, because if the weather's stormy, then planes can't land. And this was an example of a time period where it was really unusually stormy and planes weren't able to land and the stores were bare. And this is a really serious problem because underlying food insecurity in the north is already a challenge. Across Canada, food insecurity prevalences are, around 10%. But if you look in the Inuvialuit settlement region, Nunatsiavut, or Nunavut, we see rates of household food insecurity that's 5 to 7 times higher than national average. So if you already have underlying food security challenges, and then you have climate change that's exacerbating your ability or impacting your ability to get country food or locally harvested food or store food, it makes the situation even worse. And as an example for locally harvested food, in these photos you can see caribou in Labrador. And there's been some studies that looked at where caribou are going. So it's not only the hunters increasingly challenged to access those caribou, but the caribou are actually migrating to different places as well. So they're in Labrador, for instance, and in Nunavik, they're migrating northeast. So that means that people have to travel further to access those caribou. And furthermore, right now, there's actually a huge decline in the caribou population, which has resulted in a hunting ban for this area. And the decline is due to a number of reasons, one of which is climate change. Water security is also a challenge. The This is a quote from a male Inuit in Labrador. Could participant number 5 read out his perspective?
It also makes quite a big difference too at the cabins, where you generally depend to get your water source while you're there. There's very little water trickling on the brooks, and this is due to limited snow, but then it's a lot to do with the heat as well. The heat is really drying up a lot of those ponds and a lot of those brook areas.
So you can imagine that when people are going out to their cabins or out on the land and they're collecting their water in those blue containers that you saw earlier on, if there's less water to get, then that impacts water security, but also the quality of water is changing. And we did one study that found that after a period of heavy rainfall or rapid snowmelt, on the same day in the brooks where people go to collect that water and drink it untreated, there was a significant increase in indicator bacteria. And 2 weeks later, there was a significant increase in clinic visits for diarrhea and vomiting. And we know that under all the climate change scenarios for this area, we're expecting to see an increase in periods of heavy rainfall and rapid snowmelt. So we know that in the future, this is going to be an increasing concern. And so you can imagine that if climate change is impacting people through forest fires, it's impacting the food that people eat and the accessibility of the food, if it's impacting their water quality and water quantity, you can imagine that these also have really important mental health impacts. One Inuit elder told us this.
Horrible, horrible, horrible. So that is my first thought about climate change. Already look at what has happened with people losing that sense of identity and pride, and people feel proud of bringing that fish home and that caribou home, and they share it with people. So losing the ability to provide that and give that satisfaction from giving and sharing and feeding your family, it is going to continue to erode.
And this was a really common sentiment throughout the region. And this was actually a surprising research result for us. When we were talking to people in Labrador about how climate change was impacting their health, we expected people to talk about water, we expected people to talk about food, we expected people to talk about injury when they're out on the land, but we didn't expect them to talk about mental health. And this was one of the main things that was brought up in the interviews. And this was also a gendered experience. Men and women described their emotional experiences with climate change differently. So for instance, women identified being angry, frustrated, and scared significantly more often than men did in response to these climate changes. So you can imagine that if someone is, the mental health stresses come for a number of different reasons. So for instance, if somebody's out on the land, and imagine if you're out on the land, for instance, and you're traveling on unsafe ice conditions, or a storm unexpectedly comes in, that's really stressful to navigate through. You know, you're literally sometimes putting your life on the line. But you can also imagine how stressful it is for people who are at home. So if you have a loved one who's out on the land and you know that there's bad weather coming in, and there's no way to contact them because there's no cell phone service or anything like that. So you don't know if they're safe. So people talked a lot about the stress and the worry that they had about their loved ones being out there and not knowing whether or not they were safe. But in spite of all this, people in the Arctic have a ton of resiliency. So another elder told us this about climate change.
I guess it's all the pieces, like dominoes, all touches each other. I mean, everything you do, our Inuit way of life and our way of thinking is all intertwined and interconnected to the environment. So something as significant as changes in the temperature and in snow and rain and that kind of thing, it's all going to have a ripple effect.
And this interconnectedness is maybe what increases the risk of climate change impacts, but it's also what increases people's resiliency. People have really close relationships with the environment, and they're adapting to these changes. So in this photo here that you'll see, there is someone, this hooks onto the back of a skidoo. So someone is out hunting, and they have on the back of their skidoo, this is being dragged, and they have a boat. So this person is out on the snow and ice in their skidoo, and when they need to navigate over water, then they pull out the boat and they use the boat over that piece of water. And that helps them navigate through changing or unexpected conditions in the environment. So this is just one example, but there are tons of examples of how Inuit are adapting to climate change in real time. And Inuit are actually playing a lot of leadership in climate change adaptation in the international scene. So we have a lot to learn from Inuit in Canada. So this is the part, usually when I'm talking to media, this is the part where people say, yeah, but how does that impact me? The Arctic is somewhere really far away, and it's impacting people up there, and that's obviously not a very good thing, but I don't see how it impacts me. But what the science tells us is that it actually already is impacting each and every one of us. And the changes that we see in the Arctic also impact each and every one of us. So for instance, melting glaciers, melting ice sheets, that results in sea level rise. And that can impact people not only in the Arctic, not only in North America, but in places as far away as Fiji. So what I'd like to do is I'd like to spend the next part of this presentation talking about how climate change impacts each and every one of us in this room. And as I go through these slides, I'd like to invite you to share your own stories about how climate change might be impacting you. So if you're on Twitter, use the hashtag #ClimateChangeImpactsMe and share the stories about how climate change is impacting you. Or maybe it's impacting a loved one, or maybe it's impacting one of your children, and share those stories. So I'm going to focus on 4 different things. And there are many more things I could have focused on. This was actually hard to narrow it down to 4. But the first one is heat waves. The second is wildfires, our food, and our mental health. So climate change is resulting in an increase in heat waves. And heat waves impact our health in a number of different ways, including increased mortality and morbidity. And the morbidity is things like heat stroke, heat stress. I don't know if anyone in the room has experienced heat stroke or heat stress. I've definitely had heat stress before. And it also results in increased hospital admissions. And these impacts vary by age, gender, location, and socioeconomic factors. And what we know based on science is that heat waves have increased over the past couple of decades. There's even been research coming based in Edmonton, that in Edmonton we're experiencing an increased number of heat waves over the past decade. So we know that heat waves have increased. We also know that these increases in heat waves have resulted in an increased number of deaths and also resulted in an increased morbidity, so increased heat stroke or things like that. And we also know that when we look forward, under every climate change scenario, we're going to see an increase in these heat-related mortality and morbidity in the future. So I wanted to show you this one example. There's studies like this from all over the United States and all over Canada, but this one has a nice graphic, so I decided to pick it, and it's from Chicago. So here on this graph, we can see that in 2010 to 2039, under a low emissions scenario, we'll see a little bit of an increase in extreme heat waves in the future. We can see that under a high emissions scenario, that it's about double. So, we see a bit of an increase, and if we start reducing our emissions, we'll definitely reduce some of those health impacts. But the difference isn't that much. But then if we look to 2040, we see bigger differences between a low emissions scenario and a high emissions scenario. And if we look to the end of the century, you see massive differences in the number of expected heat waves. So you can see that what we do today, the decisions that we make today, matter tomorrow, and they will continue to matter into the end of the century. And the impacts are inequitable. So research in Canada shows that the elderly in urban areas will experience the greatest heat-related mortality this century. Next, I'd like to talk about wildfires. And I moved, as was mentioned in the beginning, I moved to Alberta about a year ago, and wildfire season was something new to me. I hadn't experienced it before. And that we all know that when there's a wildfire and the winds are coming in, it impacts the air quality. And that has really important health impacts, including increased mortality, increased emergency room visits, mental health impacts, physical impacts like burns, cardiovascular distress, and respiratory distress. So especially if you have an underlying condition like asthma or COPD, in those types of poor air quality scenarios, it really impacts what we do. It also really impacts people who use the environment a lot. So if you're a runner and the air quality is bad, you might be less likely to run. You might be less likely to cycle into work that day because the air quality is bad. So these types of impacts can impact all of us. And we know that they're going to increase into the future. We also know that this is related to climate change. So we see increased fire activity over the past 2 decades. We've seen increased fire occurrence, increased area burned, and increased ignitions. And we know that there's a climate change fingerprint in this. In Canada, there's been studies that have attributed the increase in forest fires and wildfires to climate change. And there was one study that quantified this in the United States. And they found that half of the increase in the annual area burned in the US was attributed to anthropogenic climate change. And we know that this is going to increase in the future. So imagine looking forward what that will look like if we see more and more forest fires. Climate change also impacts the food that we eat. It impacts both food safety, but also nutrition. And what I wanted to do today was just highlight an example of how it impacts our food safety. So there's been some really great research coming out of British Columbia looking at oysters and looking at Vibrio in oysters. And Vibrio causes like gastrointestinal upset, food poisoning, and we've seen in the past 2 decades that there's been an increased number of outbreaks. And this is really surprising because this is something that didn't used to happen. It used to be something that happened further south in warmer ocean waters. It wasn't really something that public health authorities or units were thinking about that much because our waters were colder. But in the past 2 decades, we've seen not only outbreaks along the British Columbia coast, but we've even seen outbreaks in this as far north as Alaska, which was super surprising. And this is directly attributable to climate change. There's also been some really excellent research that looks at that looking forward. So how will that change in a warming climate? And we know that it's projected, these outbreaks are projected to significantly increase by 2060. But we also know that there are things that we can do to prevent some of those impacts. And this is where public health and public health interventions play a really important role. So there's some modeling that was done that showed that effective adaptations to reduce some of these health impacts include things like increased surveillance and monitoring of those oysters and the monitoring of the water itself for that bacteria, and also temperature control regulations. However, we know that under high emissions scenarios that these public health interventions won't be able to keep up. And finally, I wanted to talk about mental health. So we know that mental health, there are a number of different things impact mental health. So the social determinants of health, the ecological determinants of health, but also different hazards. So increased flooding events, wildfires, drought, all these other things impact mental health. And research has shown that that leads to increased post-traumatic stress, anxiety, depression, suicide ideation, worry and fear, the list goes on. But there's things that we can do in response to that. So just to give you some examples of what the research has shown in this area, we know that seeing things in the news all the time impacts our mental health. So I don't know about you, but for me, when I see the impacts of increasing intensity of hurricanes devastating the east coast of Canada and the United States, that has an impact on me. When I see increased flooding events where people have to be evacuated from their homes, those images and videos, that impacts me. When I see footage of people not knowing whether they're going to need to evacuate their house because of a forest fire, that also impacts me. But it impacts the people, and research has shown that it's not just me, that a lot of people in North America feel that way, and a lot of people experience that same worry and stress and anxiety. But imagine being the people who actually live there, being the people who are impacted by those floods, or being the people who might need to evacuate from their home and they don't know whether or not they're going to need to leave. Those people especially experience really, really important mental health outcomes. So those are the 4 ways that climate change already impacts all of us. And now what I'd like to do is find out what our collective experience of climate change impacts are. So we'll see if I can. All right, so for instance, Chelsea in Prince Edward Island says, living on an island, climate change impacts me in a very noticeable way, rising sea levels. We see climate change impacts me by generating more extreme weather events in my day-to-day life. Another person says, climate change impacts me. This year in Edmonton, we had several special air quality statements due to wildfires. Additional people say, let's see, there's more popping up. I welcome you to check this out. The link is climatehealth.everwall.com, or you can follow the hashtag on Twitter. But our actions do matter, and there's different actions that we can take in response to climate change impacts. The first is mitigation. So that's doing things like turning off the light switch, that's doing things like carpooling to work and reducing our emissions. We can also do things that are related to adaptation. We know that even if we completely stop emitting greenhouse gases today, we're committed to a certain level of warming, and that level of warming will increase health impacts. We know that. So we have to do things in response to that to adapt to that warming. So that could be something like using your phone and looking at the air quality index before you go out for a run. And the actions that we can take range from the individual level to the international level. And this is really important because we can all do something about climate change, but our governments also need to do something about climate change. Public health units need to develop interventions and public health programming in response to climate change. They need to develop preparedness and response plans. At the international level, the UN is doing really important work with countries creating international climate change agreements related to both mitigation and adaptation. So this is sort of like the summary of this presentation. We can see here on this graph, we are here today, and that line is increasing temperature. So the black line is the observed increase in temperature. And we know that when we sit here today and we look forward to the future, we have different climate change options, and we have different climate change futures. And they look like this. So if we completely, stick to the Paris Agreement set by the UN, and most countries have agreed to this, to drastically reduce our emissions by 2050, we'll still see a little bit of warming. We're committed to that already, and we're still going to see public health impacts. But what the research tells us is that public health interventions, things that we can do on an individual level, those things can help reduce those climate change impacts on our health. So we can handle those climate change impacts. But if we continue to emit greenhouse gases at the rate we are now, those impacts in the future are going to outstrip our ability to deal with those health impacts. And so, what we do today impacts our future, and will impact how we experience climate change impacts on our health. So my concluding thoughts for this presentation are that climate change already impacts you, that these impacts are projected to get worse, and the time for action is now. Thank you very much.
Thank you, Sherilee. Thank you for that thought-provoking topic, and lots for us to think about and act on. I'm sure many of you have questions for Sherilee, so I'll open up the floor for questions. And people joining us online, Rachel is there, and she'll read out the questions at this. Let's start.
Thank you very much. For us who are landlocked here and quite a ways away from the Arctic, I think most of us will agree that it was very good to hear about what's happening up north. But then there are metrics that actually apply to us here who are landlocked, and one of them, I don't know if you've looked into it, is the number of frost-free days, because is that not a measure here? The only trouble is it can be, the fact of, fires, unexpected precipitation events, and all of that kind of thing. But I'm really talking about our ability to raise our food locally. Do you have any comment on that?
Yeah, I think that's a really important point. Growing food locally is another really great climate change action that you can take. And actually the city of Edmonton is promoting that right now, that we've tried to do that more and to try and build capacity in that area. So I think that our ability to do that and doing that better is really important. And in terms of climate change metrics, yeah, there's a lot of studies in the agricultural field projecting different metrics, including frost-free days, but also things like drought, soil saturation. There's a number of different metrics that they're looking at and linking that to how that will impact our food security. Thank you.
Hi, Sherilee. This is coming from online. How do both the medical school and the School of Public Health affect climate change, and what should be their roles in helping society to adapt and mitigate climate change and its consequences?
Can you say the first part of that again? I'm sorry.
How does both the medical school and the School of Public Health affect climate change, and what should be their roles in helping society to adapt and mitigate climate change and its consequences?
That's a really great question, and there's been some research, especially in the United States, looking at hospitals and teaching hospitals and the waste that's generated and their carbon footprint. So I think that being aware of that is one thing. Another really important component is increasing training. Training physicians, nurses, public health practitioners, people in the public health field and the medical field in general, in climate change response and climate change preparedness, in understanding how climate change impacts our health. These are all really important things that are increasingly need to be taught. And actually, on one of the first slides, one of the news stories that was covered in the past 24 hours is that in Italy, they've now introduced legislation that climate change is required to be taught to everyone. And I think that that highlights the importance of it, and I think that we can take that lesson from Italy and definitely apply it to the School of Public Health and the Faculty of Medicine.
So in some of the recent heat waves, there was a huge difference between how many people were being admitted for heat stroke in Montreal versus Toronto that ended up just being a matter of Ontario hospitals not properly recording people coming in for heat stroke and putting it down as something else. So I was curious about like what kind of initiatives can be created from a public health perspective about accurate reporting and raising awareness about, you know, what are going to be the symptoms of climate change functionally.
That's a really great point. And I think that, you know, again, increasing education is really key to that. But I think the public health response is too. All of the research that's been done in Canada looking at the different jurisdictions in terms of climate change preparedness, doesn't matter what metric you look at, whether it's preparedness for health impacts, preparedness in agriculture, Quebec is the leader. They are on top of this. They have a ton of really great programming, so it doesn't surprise me at all that they were, you know, better recording these things in Montreal than they were in Toronto.
So one of the health impacts that has received a lot of attention is vector-borne diseases. So that could include Lyme disease, which I emphasize hasn't really reached Alberta yet, but it certainly could. And farther south, mosquito-borne diseases, both viral and of course malaria. So perhaps least of all would the impact be in the Arctic, but would you like to say something about that?
Yes. This was one of the things that I almost covered today, but I wanted to only pick 4. And vector-borne disease is an important one. So some of the work that I do with the UN Intergovernmental Panel on Climate Change, right now we're assessing the literature looking at health impacts of climate change in North America, and vector-borne disease is a huge one. In fact, a lot of the earlier climate change studies were on vector-borne disease. So there's a huge body of literature on this and an important one. And I think that you mentioned some of these things already. And then if we map that, we can see that Lyme disease, West Nile, chikungunya, all these things are increasing. Chagas disease, yeah, I think I mentioned them all there. So that's a really important area of research. It's really hard to study that too because it's not just the climate. There's also a lot of environmental variables that go into that. But I would say that definitely vector-borne disease is leading the way in terms of climate change and health research. Sorry.
Yeah, okay. I can probably just, yeah. I'm just, oh, someone already. So let's go next. Okay, yeah. Wondering how you would recommend, sorry, thank you so much. I really appreciate how it's kind of focused on the communication aspect of it. So it's that. How do you recommend responding to people who say that you need to balance the environment?
That's a really good question. So the question, just for the people online, in case they couldn't hear, the question was, how do you respond to people who are weary of whether we can balance climate change and the economy? So actually, I have another slide on this. One of the best things that we can do is to talk about climate change. And research shows this over and over again. One of the best things we can do is start talking about it. And there's this really great TED Talk online. Oops, wrong way. I think it's this way. Yes, by Catherine Hayhoe. This is excellent. And she goes through and talks about how you can talk to people, climate science deniers. And I think that, I mean, the bottom line is, and there's an increasing body of research that's showing that those two things aren't mutually exclusive, that you can reduce greenhouse emissions and still have a thriving economy. But I recommend this TED Talk. It's really excellent.
Hi, Sherilee. Thanks very much. My name's Anna Johnson. I'm wondering how the leaders of our healthcare system should be preparing for climate change, what actions they should be taking, and what things they should be thinking about.
Are you thinking any particular sector, like primary healthcare?
Just the leader of, for example, Alberta healthcare. So what kinds of things they should be thinking of as healthcare as a whole?
So they should be thinking about adaptation and mitigation. So they should be thinking about mitigation in terms of their carbon footprint. They should also be thinking about adaptation in terms of creating vulnerability assessments are a really important thing that is actually now mandatory in Ontario. All the public health units in Ontario have to have a climate change vulnerability assessment, and those assessments are really helpful in identifying areas where there's less preparedness but there needs to be more, areas where there's really high risk, areas where a lot things have happened in the past and we need to learn from those. And then I was going to say one more thing. It's gone. Disaster planning, yes, that's a really important one too. So disaster planning. The other thing is for people who are sort of on the front line and talking to clients or patients, being prepared to talk about it. Actually, the physicians who I've talked to about this say that there's an increasing demand of patients wanting to know what their doctor or what their healthcare provider is doing about climate change, or how they what they should be doing in response to climate change. So also providing education again to those healthcare providers on how to have those conversations with their clients or with their patients.
Hi, Sherry. Thank you so much for your presentation. I wanted to ask if you can give any examples of countries or locations where they're really doing a great job at fighting climate change, and if you can give any examples of what actions they're taking that are helping to mitigate the risks in the future.
That's a good question. I know lots of places that aren't doing very well. I think that in general, European countries seem to be a little bit ahead of the curve. Both in terms of the research that they're producing, so their knowledge base upon which they take action, but also the actions that they're taking. Germany, I would say, probably rises to the top. They're investing a lot of money in understanding how climate change is impacting them. Countries that are faced with sea level rise are taking a lot of action just because of the high value infrastructure that they're trying to protect. So I would say that European countries come first to mind. In North America, we're absolutely lagging behind.
Hi, thank you for a very insightful presentation. I'm wondering if your research has touched on the topic of climate migration, if you could speak to that issue.
That's a really important topic. Migration has important health impacts, especially in terms of mental health and wellness. In the places that I work in the Eastern Arctic, Relocation and displacement has a really bad history and has led to a lot of social challenges and problems. So that's not really an option there. But in other places, climate migration is actually a really important adaptation strategy. So when people are mobile and they can move, that's an important option in terms of our adaptation toolbox. So it can be a really good thing, and in some places it can be a really bad thing. And I think that the most important thing to remember is that local context really matters. Yeah.
Hi, Sherilee. This is coming from online again. There are wildfires every year in different parts of the world. Similarly, there are floods, landslides causing large impact on public health, including mental health. What can be the role of public health professionals in this context?
Preparedness. Response, and education. And those vulnerability assessments, I think, play a really important role. So I think also research. Research plays a critical role in this, because if we're making response plans, if we're making preparedness plans, if we're doing climate change vulnerability assessments, the value and the effectiveness of those plans really depends on the underlying data and the underlying experience of that area. And we do know from climate change literature that the way that climate change impacts our health and the way that manifests in local health, it varies from place to place. So having localized information is really important to be able to make good decisions.
Hi. So I work in an Indigenous organization in the Environment and Climate Action Team. And so for some of the things that you said, like help combat the mental aspects of climate change with like community-based practices and awareness initiatives, stuff like that, I'm familiar with. However, I'm not sure how to address, as someone who's not a mental health professional, how to address some of like the mental, emotional concerns that community members bring up. So do you have any suggestions for how to like respond to the mental side of things, or like initiatives that could particularly ease the mental health concerns?
That's actually a really hot topic in research right now. And the reason it's such a hot topic is because we don't know. We don't know what the most effective way is yet. I can tell you that in some of the preliminary work that we've done, especially some of the work that I've done with one of my colleagues, Ashley Consolo, who's an expert in this, is that people, one of the most important coping mechanisms is to spend time outside. Spending time outside can help people heal. It can help people like reduce that stress and anxiety. It's really hard to counter that when climate change is impacting our ability to go outside. But that's a really important question, and the research on that is really just emerging.
Hi, Sherilee. Another question from online. We have 25 people joining us tonight, so it's a good turnout on our online audience. You mentioned earlier that the rest of Canada has a lot to learn from northern communities and how they're responding to the effects of climate change. Could you elaborate on this, or perhaps provide some examples?
Sure. Well, I think the number one, I'll provide two examples. One is that they're talking about it. So when I was doing my master's research, people were talking about climate change. It was in on everybody's vocabulary. People knew about climate change. Healthcare practitioners, public health practitioners, they were already talking about climate change. They were already thinking about climate change. So climate change in the north, when you go to the north, that's like something that's on day-to-day conversations. I was just on a trip to Yellowknife visiting a colleague, and she was showing me how her house is, like her deck is like departing from her house because of the permafrost thaw, and she's had people come in there to try and, like reinforce that infrastructure. And so through that example, you can see that this is something that people deal with on a day-to-day basis, and they're talking about it, and that talking about it is really important. The second thing that they're doing is they're planning for it. So northern communities have really strong climate change vulnerability assessments, and they're taking action on it. So they haven't just done the assessment, they're actually making changes to programming and policy in response to those vulnerability assessments. So while in Ontario, just recently now everyone has to have a climate change vulnerability assessment done, the next step for them is to start taking action and making changes to their planning and programming based on those vulnerability assessments, which is what the North has been doing for years.
Hi, thank you for your presentation. So my question, you touched a bit on the inequity. Can you go into a bit more detail on the impact, the inequitable impact of climate change. So I'm assuming that people in the north, indigenous populations are going to experience the greatest impact. Who do you think will experience the least or even benefit from climate change?
That's a really good question. There's a lot of really good research coming out of the United States on this topic. So one important thing about like the inequities and who's impacted the most is it's not just one group, it's the intersection of different groups. So there's been an increasing number of really useful and novel studies that have been looking at that. So it's not just low socioeconomic status neighborhoods who maybe have less access to air conditioning, it's also the elderly who live in those areas and women, for instance. And they're actually able to attribute different amounts of impact based on those different combinations of factors. In terms of who benefits, I have to say that all the research that I've looked at from a health perspective, by the end of the century, we're all losers. The science is really clear on that. Yeah, thanks.
There's a question in the back.
Hi, Sherilee. Thank you for a wonderful presentation. And first of all, welcome to the University of Alberta.
Thank you.
But also welcome to Alberta. In the dead of oil country, you're in the lion's den. I do want to ask about the budget. So the new budget is allotting $610 million to the environment and parks. And there's a lot of bullet points that seem very important about climate change, but what is your perspective, and do you think that the Alberta budget is going to be effective over the next 4 years in mitigating climate change?
Well, I have to say that that's a really good question, first of all. Thank you for it. I know the climate change and health literature very well. I know less well the climate change and economic pieces and those other pieces that you spoke to. But I think those are all really important points that we should all engage with, and we should all talk to our, our MLAs and our MPs about. I think we should be familiar with the climate change platforms of the parties who represent us. I recommend that. And I have to say too that, living in Alberta, I do see a lot of hope. I mean, the youth that have been out on climate strike, for instance, that's been really inspiring to me, and that gives me a lot of hope that, in Edmonton, thousands of people have been out protesting about this topic because they care about it. And I know that there's people who look at it from the other side, but that's being increasingly the minority. For Canada as a whole, the majority of Canadians think that climate change is real and that climate change is already harming them. That percentage is less, for sure, in Alberta, but it's a growing number, and I think that perspective is a growing minority.
We have time for maybe one last question. Wonderful. Let's wrap it, and let's thank again Sherilee for a fantastic talk. And climate change is a public health issue. And what is inspiring is that reaffirmation that individual actions matter. We can all make a difference. And collective actions matter a whole lot. And so as groups, as school, we need to work deliberately on mitigation and strategies and going forward. So I want to thank this partnership for coming out today to listen to this talk. We have students and faculty and staff. We have donors and partners as well. And a big round of applause for the whole community of public health who are advocating for this topic. One last housekeeping matter. Our staff would have given you a sheet to fill, our feedback form. That's quite important for public health. We do evidence-informed planning. So the feedback that you provide will shape the programs that we have in the future. And so again, please take the time to complete it and drop it on the box. And thanks again for coming, and good night.
I can feel like on either side. Yeah, perfect.